just about anywhere you go now, someone's coughing on you, someone's sneezing on you. It is officially allergy season. And joining us this morning is Dr. Alfred Johnson, who is here to kind of talk about ways that we can learn what allergies we have and prepare for this heavy allergy season. Welcome. Good morning, doctor.
Good morning.
So we're all talking about, Dawn and I were talking about that allergy season is everywhere. I mean, we're in full-fledged allergy season, and a lot of it has to do with the shifts of climate. When it comes down to our allergies, what pollens are in the air right now and that's causing just this heavy shift into a lot of people suffering from allergies?
Right now is mountain cedar. You get the wind out of the south.
Mountain
Cedar
cedar.
Hill is south of us.
Oh, that jerk mountain cedar.
Austin, Texas has plenty, and all the cedar south. And then there's other trees that start to bloom, cedar elm, and then grasses that will be coming in. But in Texas, it's wonderful because we have allergies year-round.
Yes.
We don't have snow cover, so molds are always present, particularly when the wind picks up. And a lot of times molds will have a delayed reaction. So it's windy today, you feel bad tomorrow morning when you wake up because your head's all stuffed up. And it can even cause aches and pains and kind of brain fog.
Yeah, because I think a lot of us associate allergies with like itchy nose, watery eyes, but it can be so much more than that. You mentioned head pain.
Oh, exactly. Headaches.
Well, and I had mentioned that because I developed allergies here in Texas, and I was getting ear infections. And when I had the sinus infections, like, you could feel it through my entire face, and it was awful.
Exactly. Well, the allergens cause an immune response, which is inflammation, and then inflammation hinders your body's immune response, and so you get secondary infections. And it depends on just what your immune system doing, how much allergic reaction you have, to what extent, and then whether you can fight off the bacteria that's secondary.
Doctor, I was going to ask you too, and Dawn just brought it up and said that she started to get allergies. So as an adult, you can get adult onset allergies, or if you move to a different place, you can start having allergic reactions to things, right?
Oh, exactly. And even if you move into like a moldy house, a damp house, you may have lived in one house in Texas, moved into another one that's not a healthy house, and you get exposed to molds, which affects your immune system, causes mold allergy, and even some molds produce toxins, which affects your nervous system.
And something that my mom did when I was younger is figure out what I was allergic to. That way we knew how to prevent it. Is it important for people to have allergy testing done so that they can then know when they hear, okay, mountain cedar's high, like I'm really allergic to ragweed? Is it important for us to take these allergy tests so we know what we're allergic to ahead of time so we can prevent it?
Yes, it is, because then you know what time of year it occurs, what it is. If the allergy medicine over the counter is not helping, then you need to really get allergy tested. I specialize in seeing people that have unusual allergies or not responding to the typical treatment. We test one item at a time so we can see cause and effect relationships. And then foods compound pollen allergies.
Well, maybe a cold, though. How do you know the difference between an allergy and a cold?
Well, sometimes it's hard, but a cold, typically you'll run fever with it. You'll ache all over, kind of like the flu, but they mimic each other. And so that's why it's important to figure out whether it's just the winter cold or whether it's the mountain cedar.
Well, doctor, I suffer from asthma, so for me, if my allergies get really bad and it goes into my chest, then it can almost stir a whole other set of problems, which is my asthma and breathing. But something that a lot of people are nervous about using is over-the-counter medicines. Are over-the-counter medicines, are they kind of just a temporary Band-Aid, or can some of them really help, like Claritin and those, for example?
Well, they treat symptoms, so they cover it up. There's nothing in those medicines that really help build up tolerance to it. And that's where allergy shots come in, because they're the one thing that you can take that builds up antibodies to block your allergic response. So that's why it's important to find out if you aren't responding to over-the-counter medicines and you're getting worse, definitely see your doctor.
See, and that was my question, because I'd been given Zyrtec and Flonase, and I was basically told I have to take these every day for the rest of my life, and I'm like very resistant to that. Are there other things I can be doing besides getting an allergy shot that might help?
Well,
Move. Back to California.
Get out of Texas.
Get out of Texas, no. Well, there is. I mean, there's some other medicine that kind of helps, that doesn't have the side effects of those, but it ends up being medicine. Like Singulair helps block some antibody responses and some inflammation responses. They just came out with over-the-counter steroid nasal spray. Which will help some people so they don't have to go to the doctor to get it. But you use Flonase, which is a nasal spray, and it affects your mucous membranes. It causes irritation. It burns. And so
bloody noses. all of
Right.
that. So it's not been pretty.
No, it's not ideal, and that's why a lot of the patients I see are on allergy immunotherapy, and it takes a couple of years to build up tolerance, but it's the one thing that does solve the problem.
Now, doctor, a lot of people also take, they just want something to clear their nose and to clear their sinuses, and so they result in like Mucinex, or like we've talked about neti pots here. Like how do you feel about like neti pots and Mucinex? If it is, once again, is it just a Band-Aid?
No, neti pots is like giving your nose a bath. I mean, you take a bath every day, get the stuff off your body. You use neti pot to wash out your sinuses to get that day's pollen out of there. It makes perfect sense.
Okay.
And so, in the morning
Love
and in the
it.
evening, it's a cleansing process.
Such great information,
Cleansing
doctor.
process.
Thank you so much. We appreciate that. Make sure you check out our website, thebroadcasttv.com, for all the information we just discussed.